Good evening. Jai Jagannath. ସମସ୍ତଙ୍କୁ ଶୁଭ ସନ୍ଧ୍ୟା। ନୀଳାଦ୍ରୁ ଶଙ୍ଖ मध्ये ଶତଦଳ କମଳେ ରତ୍ନ ସିଂହାସନସ୍ଥଂ ସର୍ବାଳଙ୍କାର ଯୁକ୍ତଂ ନବଘନ ରୁଚିରଂ ସଂଯୁକ୍ତଂ ଚାଗ୍ରତେନ ଭଦ୍ରାୟା ବାମ ଭାଗେ ରଥଚରଣ ଯୁତଂ ब्रह्मरुद्रेन्द्र सेव्यं देवानां सारमेशं सुजन परिवृतं ब्रह्मदारु स्मरामि। परम कारुणिक अनंत कोटि ब्रह्मांडर नायक कोटि कोटि ओडियाकर हृदयर आराध्य देवता समग्र विश्व चराचरर स्रष्टा आनंद कंद सचिदानंद अखिल रसघन विग्रह परमानंद विश्व वेदनार वैद्य देवाधिदेव श्री श्री जगन्नाथंकर चरण कमल रे कोटि कोटि प्रणिपात। जय जगन्नाथ। Today the Maharishi College of Natural Law, particularly the Rover Ranger unit, is going to organize the 99 National Webinar, and I, Dr. Namita PATTANAIK, being the host and the convener of this National Webinar, welcome all of you to this Google board. I'm really happy to get all my viewers, those who are my friend, philosopher and guide, and whose presence makes me immense pleasure to continue with so many programs here over. Today we are having the title, the live webinar, that is Better Vision for a Great Life. So it's a very new topic, I know. And why I thought about this, because I know everyone is interested to know something about your eye. We know the vision is the priceless gift that's from the God. So a blessing to enjoy the beauty of the world. Eyes are the most delicate organ in the human body and they need special care. So today's lifestyle and work atmosphere, along with the use of modern appliances and gadgets, electronic gadgets for work and entertainment, like our TV, computers, all those are taking a heavy toll on the general health and well-being of the eyes. People tend to forget that eyes too need exercise as well as rest for its proper functioning. So working for continuous long hours before computer or watching television for a prolonged time, and the two without blinking, that is blinking is very dangerous to eyes. It makes the eyes dry and scrappy. So today a large section of the children, they are also not taking much of care, and they are in my pick the major culprit for this being television. And there are so many. So will listen what happened to our eyes when we feel uneasy, or how to take care of eyes when we are alive, but when we die we never thought about that. So today is a time we have to thought about our eyes after our death, how to take care of our eyes. So better vision will always continue, not only today, but it will also continue after our death. So it will be taken care by Dr. Sujata Das ma'am, the esteemed chief speaker of today's webinar. So I welcome you, ma'am. And I also welcome the president of this webinar, Dr. Nalini Prabha Mahapatra, the president of this webinar, and our best guide and the backbone of this webinar. I also welcome Dr. KP Mishra sir, the State Chief Commissioner, Odisha State Bharat Scouts and Guide, and the National Vice President to this webinar, who is the chief patron of this series of webinar. With his blessings, we are conducting this program, and I think he will bless us for years together to cooperate with the society and do something for the betterment of the society. So this is an initiative to take care of our vision afterwards when we die, but we care our eyes. So once again, welcome our madam, the principal of Maharishi College of Natural Law, Dr. Nalini Prabha Mahapatra ma'am, who will welcome officially to all the guests. I would like to say few words regarding Dr. Sujata Das ma'am. Prior to that, on behalf of all the participants, I want to welcome ma'am.
Thank you. So,
ma'am, just a minute. I want to present a floral gift to you virtually. It's a customary to present a small memento or small flower. Dr. Sujata Das ma'am, as all of you know, and you might have heard from the poster, who is she? But virtually we are able to see her in this Google platform. She is a very dynamic doctor, very young, very energetic. She is the consultant of LB Prasad Eye Institute, being the medical director there itself, being the medical director for DRUSTI DAAN Eye Bank, which is situated in LB Prasad Eye Institute, Bhubaneswar. I'll share his phone number, email ID afterwards, after the seminar is over. Regarding her medical education, you know, doctors are the incarnation of God. Should no need of his biodata, but you should know how much work she has done. Couple of times I have gone through the biodata. Madam is a faculty member at the LB Prasad Eye Institute, Bhubaneswar, since 2006. She was the director of the institute from 2012 to 17. She is the medical director of the DRUSTI DAAN, the eye bank at Bhubaneswar, very famous since 2007. She received her postgraduate training in ophthalmology from MKCG Medical College Hospital, Odisha, and FRCS from Glasgow University. She completed her subspecialty training in cornea and anterior segment from LBPI Hyderabad. That is same, yeah, our LB Prasad Hospital, that is also situated in Hyderabad. She has also attended so many programs, fellowship in cornea at University of German, clinical fellowship in cornea from the Royal Victorian Eye and Ear Hospital from CERA Melbourne, that is in Australia. So for her advanced study, she has taken a lot of care. So she is a recipient of the Developing Country Eye Researcher Award from the ARVO, that is the Association for Research in Vision and Ophthalmology Foundation, USA, and an Achievement Award from the American Academy of Ophthalmology. She is also the recipient of IJO AIOS Gold Award, BK Narayan Rao Oration Award, and KR Datta Award from All India Ophthalmology Society. She has served as a member of the OSBSG faculty for the evaluation of subspecialty education program in cornea. Currently, she is the chairperson of the Eastern Zone of Eye Bank Association of India and member of the specialist board of that is in the National Board of Examination, New Delhi, for ophthalmology. She has also served as a member of the working committee for the drafting Eye Banking Standard of India 2020 for National Program for Control of Blindness and Visual Impairment. So Dr. Das is presently involved in research encompassing cornea infection, eye banking, and genetic analysis. So many. So nothing more to say about her. You will listen from her and you will able to know about her. But she is actively involved in skill development in eye care in Orissa. Under her leadership, the recovery of donor cornea by DRUSTI DAAN Community Eye Bank has significantly increased to more than 1,000 per year and has crossed 10,000. That is the remarkable achievement. So in corneal tissue harvest since its establishment from 2007, with successful implementation of hospital cornea retrieval program in major hospital in Orissa. So I'm really grateful to you, ma'am, for sharing your time, very valuable time to all of us. On behalf of Maharishi College of Natural Law, on behalf of the president of this webinar, Dr. Nalini Prabha Mohapatra, I welcome you, madam, to this Google board. And I don't want to spoil any more time. And the floor is with you, with your other partners. I want to introduce also to them if they are here. Mr. Niladi Das, who is our alumni. He belongs to our college, Niladi Das. He is also associated with this DRUSTI DAAN Eye Bank with ma'am. Ma'am also will introduce him, and also Jyoti ma'am. So now the board is with you, ma'am. May I request, ma'am, please start your presentation, ma'am. Over to Dr. Sujata Das, ma'am.
Thank you, Dr. PATTANAIK and all organizers for the invitation. Although it was short notice, I could not say no because of eye donation. It's close to my heart. So it's two. I've divided into two parts. One is common eye diseases, and the second part will be about eye donation. We can take up the questions at the end of the session or in the chat box. I'm sure I'll not be able to cover many diseases, but at least I'll try to cover common diseases. Hope my slides are visible.
Yes, ma'am.
Okay. So the first part of my presentation is how to take care of your eyes. And most of the diseases are not preventable, but how frequently you should do eye checkup and all. So we know why we're discussing here, because the blindness is a global problem, and we have 161 is visually impaired in globally, and out of those 161, 37 million people are blind. Again, there are people who are bilaterally blind in both eyes or unilaterally blind. So 75% of blindness is avoidable. So quite a large number of is avoidable. And as we know, 9 of 10 blind people live in low-income countries. So this is a eye structure anatomically. This is the front part of eye is cornea. When we transplant only this portion, not the whole eye. The date, there's no whole eye structure, although the research is going on. But many times patients attend and ask, can we replace the whole eyeball? We cannot do anything when the retina got detached. or some problem with the optic nerve. And lens, which is a common disease, cataract affects this part of the eye. We can only replace this, and again, till date there is no replacement of cornea, although a lot of artificial cornea structure are coming up, but nothing is foolproof. So we need to replace with the human donor cornea, which is after death. So basically, how do you prevent? We need to take eye care to maintain a clear vision and a healthy vision. So for adult, how frequently we should check up? It varies from disease to disease. If somebody is healthy, then it should be 1 to 2 years. And especially once you become old, maybe it is every year once, it should be a part of your annual health checkup. Many people go for annual health checkup. But sometimes some hospitals, eye is included, some it is not included. But please, it should be done every year. So I have already told what is cornea, what is sclera. These are eyelid. Common diseases affecting different structure. I'll go into that. So start with eyelid. So eyelid basically protect our eyeball. If the eyelid is not there, sometimes people with burn, the eye remains open. So that time cornea gets affected. So this is the front layer. It automatically closes, some foreign body comes. And there are glands which and the tear film. Everybody must have heard nowadays is very common that I have dry eye. Patients from their side, they say dry eye. And I always tell, don't tell me the diagnosis, tell the finding. So the eyelid is mainly prevent drying of the eyes. And this is another eyelid problem. Although it's a small child, you can see one eyelid is below the other eyelid. So this is called ptosis. It can be due to many causes, but it should be checked. Unless it is checked, this eye, most of the cornea is covered, even the pupil is covered by the eyelid. So it leads to visual impairment, which cannot be corrected if we do later. So this can be from birth, this can be from injury, this can be from nerve paralysis. So this definitely requires a surgical correction. It does not get resolved by medical management. And this is again common infection, like funsindi, they say it's funsi, it's like a boil. Like a dandruff, we gave example of dandruff in the eye. Those who have dandruff, especially the dandruff can be seen in the eyelid margin. So what do you do to it? We ask them to take care of hygiene. Sometimes with the baby shampoo, they can clear it every day. I tell my patient that they ask, will it be done every day? I tell them, as if like you brush your teeth, it can be clean every day. If it is not clean, then we get style. So, and recurrent redness, if it is not clean, recurrent redness. So basically you need to, this can be prevented. Or not all can be prevented. Unless you clean it, you get boils frequently. You get today, then after 1 month again. So it needs cleaning. Yeah, if it is not done properly, then you see the swelling like this. Again, this swelling sometimes needs surgery, sometimes with medical management, but it is huge one, so it needs surgery. And conjunctivitis is common cause. This may be due to many causes. This may be due to allergic conjunctivitis, this may be infection, and all of us must have had in COVID. In conjunctivitis also was affecting many people in COVID. It's around 20%. In fact, the first patient, the first ophthalmologist in China, he suspected conjunctivitis in all, and then they turned out to be COVID who passed away. Unfortunately, the ophthalmology passed away. So this is the people, what they do, mostly they don't show and they do self-medication. Especially it is harm if you use the medication which is open long back or for some red eye. So all red eye are not infection or inflammation. You need to show to to the doctor, and especially don't share the towel or handkerchief what the person is using. Other family members should not use. Otherwise, they get this infection. So this is again partly preventable, especially if it is an infection. But if it is an allergy, then it does not get transmitted to others. And allergy, usually they have a past history. They say when they go to dust, the eye becomes red, but it automatically resolves. And this is again, I'll try to avoid as much as technical word possible, but sometime it will come. So this is again a pterygium. ମାନେ ଆପଣ ଦେଖିଥିବେ ଓଡ଼ିଶାରେ ମାନେ ମାନେ ଓଡ଼ିଆ ଅଛନ୍ତି ଆଟଲିଷ୍ଟ କହିବେ ଯେ ମାଂସଟା ବଢି ଯାଇଛି. You can see this whole pupil is covered. So this is partly preventable, but most of the time it is not preventable, because this happens to people who work in dusty and sunny wind areas. So basically UV light is thought to be cause of this, but nobody knows exactly what is this. So you can avoid the UV light with protective glasses, especially those who work in field. They can prevent it. May not be completely, but again, this a small one we don't treat, but if it is a big one, we need to removal of the this piece of tissue. So coming to main cornea, which will talk about the how you donate and how what surgery we do. So it gets affected if the foreign body, something falls on the eye, and like people start using some drop, and the cornea is a transparent structure. It is not black or brown. Because of the iris, we think it is black, but it's completely transparent. So either it becomes translucent due to infection or opaque. So if there is a foreign body, again, it can be preventable. So don't rub, don't put medication, go to a doctor. If you come, the study has shown that if you go to a doctor within 48 hours, then the chance of infection is very less. Otherwise, if you put some drop, don't go till 7 days, then it will get to a corneal ulcer and leading to a corneal scar. And then vitamin A deficiency. All of us have heard about the Keratomalacia, vitamin A deficiency. So it causes dry eye, again leading to cornea affection. So nowadays it is given vitamin A regularly, but still we see Keratomalacia. Unfortunately, in India, still we see children who are affected due to Keratomalacia. So these are some of the conditions. This is a scar which, so this need cornea transplantation. This small may not be, but this no medication, no glasses can help. And this is a huge scar. This is a foreign body. Sometimes a stone, especially this one can be prevented. Those who work in grinding or welding, they should use protective glass. Even the people who go to paint, if it's just a plain protective glass they can use, that can stop foreign body going inside the eye. Sometimes foreign body will, or without foreign body also, you can see the patient who has got an infection in the eye. Then one of the commonest cause which is known to public as well as ophthalmologists is cataract. So cataract is nothing to worry, and till now, unfortunately, there is no preventive medication for cataract. It's like aging process. So it's very safe and excellent outcome compared to what it was 30 years back or 40 years back. So it's a daycare procedure. People can go to office. The next day, you just need to put medication 1 month. So this is not a irreversible blindness, but still it is better not to wait till it becomes completely mature. In some cases, if it becomes completely mature, it may burst and cause glaucoma, which is high pressure, and glaucoma is a irreversible condition. So better not to wait, because the surgery has technology, surgery instrument has improved a lot. So better not to wait till the end where it will cause all those complications. Glaucoma is a reversible condition, and the familial transmission is there, not in all cases, but if anybody has a sibling like brother, sister, or parents has glaucoma, they should visit regularly. At least after 40, they should visit regularly so that we can diagnose early and treat early. If whatever is damaged, once the patient comes, it cannot be restored. But whatever is there, we'll try to preserve this. So what is how do you know glaucoma? Sometimes they cause symptoms, sometimes is not symptom. Most of the time it does not cause symptom. By the time you know, one eye is lost. So pressure is one thing, or sometimes they cause headache. When they go to a dark like movie theater and all, they cause headache. So those cases we suspect, but not all headache is due to glaucoma. Please don't overdiagnose. Especially prevention part, I'll say that routinely, and most of the ophthalmologists nowadays do comprehensive eye examination where intraocular pressure check is a part of the surgery. So this is basically regular checkup. Other than regular checkup, there is nothing called preventive thing. And age-related macular degeneration, again, this is a leading cause of blindness. In Western countries, is is the most common cause, I'll say. Again, the nutrition is monitoring is important. Nutrition will not stop most of the time, but monitoring. Sometimes we give them a paper where you see the distorted line. There are lines where it's called home AMSLA. In home, they can check and they can know whether the crosses are distorted, the lines look distorted, then immediately they should visit. And refractive error, all of the, if the students are there, they know what is my myopia, short-sightedness, and hyperopia, farsightedness. Most of the students are whoever are myopic, almost 90% are myopic. This is more now because when COVID, everybody started using mobile phone. So nowadays the theory says you should try to avoid as much as possible near work. Maybe better to use laptop than mobile, and in outdoor activities. So encourage children to play in the outdoor activity. And hyperopia, usually after 40, it is most common, but not necessarily. Hyperopia also we see in children. And astigmatism is another type of refractive error. Again, prevention is for myopia. Age-related presbyopia, which chalicia, that cannot be stopped. Whatever you do, some people, they say that we did exercise and all. It usually does not help. So myopia can be, I will not say it completely prevented. The growth, progression can be stopped. So basically the gadgets should be not be allowed too much, as much as requirement. But COVID has gone, maybe we'll see less kids now. So this is like all those +2 school student must have read. This is metropia, and then see myopia. Myopia, basically the eye size is big. And this is hyperopia where it goes behind. So the spectacle is this is again astigmatism. So correction, how do you correct? One is like the complaint usually, I've seen parents complain that because he saw TV from close by, then that's why he got power, is not correct. Because he's not able to see, that's why they're going closer to the TV. So similarly, the teachers sometimes complain. So we just check whether how is the school performance, whether they're writing correctly or they're writing from somebody else. Correct classes is required, in especially when they're very young, like 7 years, 8 years. We need to see at a 6-monthly interval. So spectacle is required, but once they may use contact lens, provided they can take care of the contact lens. Otherwise, it's a disaster if you don't take care. Especially those who are in school, they may not able to take care. In laser surgery, is once the power is stabilized, the laser surgery is another option which can get rid. People can get rid of glasses, provided all those investigations are correct. Yes, like LASIK, everybody knows LASIK. So check, so you should know what is the objective, because 90% people will say that, why do you need LASIK? That is my first question when I see a patient who is interested. They say, no, the power is increasing, that's why you want to do. There's absolutely no in that case, because if the power is increasing, we don't do that. If the power is stable only, we do. This is not a procedure where it stops the progression. It just is a cosmetic surgery, get rid of glasses. So once the power is stable, then only it is done. And like I mentioned, vitamin A deficiency is very easily preventable. But vitamin A has no role in refractive error like myopia or hyperopia. Again, that is a common question asked by parents. If they don't eat vegetable, But vitamin A is nothing to do with refractive error. It has to do with the night blindness. So night blindness, sometimes it is a very severe, the cornea melt. If it is a milder one, child complains they're not able to see. Not going to why night blindness happens. So this is one thing which is can be avoided. I've written is marriage within blood relation to be avoided. These are sources. Is not that poor people cannot take vitamin A. It is not only in the costly roots or costly meat and all. All of us know palak is rich. All those greens are rich in vitamin A. Another new entity, again, I'll say more to do with the use in computer and dry eye. So dry eye can be either your tear secretion is less, which happens with age, and especially women after menopause or patient with arthritis, they complain dry eye. But in young generation, is not the production is less, it mostly gets evaporated when they use computer. So normally we advise them, there is a term called computer vision syndrome. It's already in the textbook. Try to blink frequently. It cannot be like if you think, look at the app, the blinking red decreases. So you have to proactively think and do that. I need to blink frequently and look at a distance. It says 20-20-20 rule. After 20 minutes, give a break 20 seconds and look at distance of 20 feet. So these are some of the preventive measures to prevent dry eye, those who use computer. In case it is not getting resolved, then we use lubricant. Again, in lubricant, although there is not a very serious side effect due to drug, but as much as possible, it should be preservative free because everything has its own. And another lifestyle disease which we see commonly and can be controlled is diabetes. Diabetes affects eye in many ways. One is cataract. Glaucoma is associated, but cataract can be taken care. As I told, nothing to worry. But provided you don't have a diabetic retinopathy at the back. So if you have a cataract, you remove cataract, your retina is not good, so you are not able to see. So as most of the laymen, as a patient, they think that lens is everything. I did cataract, I paid so much money, why we're not able to see? But diabetic retinopathy, but then they say my blood sugar is controlled now, but it is not controlled for so many years. So that's the diabetic retinopathy. So diabetic retinopathy people, even if there is no retinopathy, we need to check every yearly. And if it is you have already diabetic changes, then the frequency changes based on the severity. So this is normal retina, this is the optic nerve and the vessel, and you can see a lot of bleedings here. Lot of bleeding and exudate. This is diabetic retinopathy, and you again you may need medicine is not going to help. So sometimes they need injection, sometimes the laser treatment. So better not to go up to this stage by controlling blood sugar and regular checkup. So this is how you see normal and a diabetic retinopathy. And other systemic disease which can affect eye, HIV and hypertension, diabetes we already discussed. Thyroid is another thing. Sometimes you can see the eyeball is proptosed, whole eyeball is proptosed. This is due to thyroid. Heart disease may affect eye. I told about the dry eye in rheumatoid arthritis. Again, it's slightly more common in female. And dry eye it can be milder form or it can be severe form where the cornea completely melts. And ankylosing spondylitis. This is an uveitis. Ankylosing spondylitis means somebody is a hunchback, little bit back pain, lower back pain. This is ankylosing spondylitis. And drug toxicity. Because of you take so many drugs, sometimes it may affect eye. In headache, we see a lot of patient due to headache. It may or may not be related to eye. It may be due to ENT problems, sinusitis, sometimes migraine, sometimes blood pressure. But try to please rule out anything related to eye. It may not be, but better to rule out causes of any eye problem. So all we discussed about adult eye, but coming to a child eye, in Western countries mostly they do as soon as the child born, they check up everything, but it is not yet the part of our system. But as much as possible, it should be done at least past examination 6 months of age. But if they are like not able to follow fixed light, it should be seen still early, not have to wait till 6 months. Only one thing today nowadays is very good, especially I'll say in Odisha. I don't know about people outside Odisha. The RBSK by government, they bring the children when they know, when they see, when they screen and they see, they bring it to us. But still there are people, there are children who have not, the system has started recently. Those who have problem long back, they come now. Sometimes it is possible to do, sometimes it's not possible to do. UV light exposure, I told about pterygium, and pingucula is same, is a small thing in conjunctiva, cataract and macular degeneration. So eye protection, UV light protection, there are specs available with UV light, especially those who work, I told about the welding, and in the field they should take care of with eye protection. And we also advise the people who lost already one eye, because for them it is one eye, so they should take protection about this. So eye examination is most of the time in some places they just check the vision as eye examination. It's not a complete eye examination. Um, uh, I don't know, those some of you might have visited LV Prasad Eye Institute. The people usually say, oh, it takes so much time, but we do complete eye examination. It starts with a history, then we check the vision, then whether the is focusing, then all patients we check pressure, then external eye examination, internal eye examination, then color vision, corneal topography wherever it is required. These are additional tests, but the routine test is this. So anytime anybody visits other places, so they can always check if you are 30, 40 years or more, ask about the eye pressure or retina checkup at least once in a year if you don't have anything also. So I think I covered whatever common diseases, and especially my focus was on prevention. So Namita madam, should I go to the other one now or?
Yes, madam. Yes, madam.
Okay. Can you see the slide?
Oh, not now.
Not now?
Not now.
Let me stop again. I'm stopping it. I think I'll say here.
Yes. Yes, ma'am. Now it is setting.
No, okay.
Yeah.
What is it saying? Something.
Security alert.
Yes, I'm thinking enable external. Yes.
Yeah.
So I'll talk about the subject which is closer to heart. I think other than Niladri, I don't know whether Jyoti is here. I saw Mrs. Sundarajan, who is the founder of DRUSTI DAAN.
Yes.
She is here.
Yeah.
It was started in 2002. And we got our first cornea by 2004. And from 2004 to it, I'll show the slides how it is grown. So why we are talking about blindness already I have told, but especially corneal blindness because the patients are young compared to other blindness. Like cataract blindness, they usually old. Retina blindness, they're usually old. And if we don't treat, it's a higher cost of treating at the later stage. And young people, their whole life is ahead and they're dependent on somebody. So this is what I told, that the ability to adjust life years is quite high compared to cataract blindness. So this is cornea, the clear structure. and its main function is to converse light rays, and it again, like lead protects whole eye, this protects whole interior thing. So I'm not going to this. This is cornea. So this is pipe layers. The front layer and the major portion is stroma, the descent. So all these, like anatomically, they're so nicely organized so that it is transparent. So as I mentioned, it's protect the eye from dust, germ, and other foreign bodies, and function like window that controls and focuses the entry of light into the eye. It contributes 65 to 75% of eye's total functioning, and it protects some UV light too. So once it gets infected, you can see this is infected, and this is after the healing. So this is a corneal graft, how it is replaced, and you can see this is a margin here, and you can see few sutures are there. So once we get a donor cornea, actually one donor helps to or two cornea blind. Sometimes nowadays with a new procedure, 3 or 4 also. Because the front layer is used by some recipient, some patient, and the back layer also. So it is more common in lower socioeconomic group because the cause, yeah, this is cornea blindness. In India, we need 2 lakh cornea per annually, but we collect around 30,000. So we need to improve. That is the region we are meeting here. I expect all of you will be ambassador for this cause. So why do cornea gets opaque or translucent? Injury can be due to anything. It can be chemical injury, those who work in factory, a mechanical injury with iron wear. Lot of time we see this is partly preventable. The people used to in this are the bike that wear that injures cornea on the back of the bike to keep the luggage and all. So malnutrition again with mostly vitamin A deficiency. Infection again in India the infection is more with which is not seen in Western world. Chemical burn due to either acid or alkali. From birth, some corneal opacity are birth, so they burn with cornea, AG cornea, or after surgery. So these are like this is a condition which usually in a young around 16, 17 years starts. So although it looks clear to you, but sometimes in advanced cases, neither glasses or contact lens can help. In mild cases, glasses, moderate cases, contact lens. This is a keratoconus, and this is a corneal scar. With cornea is normally without any blood vessel. So that is the region compared to other transplant, cornea transplant works well. Although it gets rejected, but it's not so frequent. So if it is like this, then its chances of rejection are more. And this is a corneal scar. Again, this is a genetic disorder, dystrophy. So sometime we might need to remove that and put a cornea. So cornea transplant, what we do, we remove this cornea and replace with a healthy cornea from a donor. And donor, what we check before we replace? We get the tissue from the donor, either from the home or hospital, and then bring it to do a lot of tests in the eye bank. So we take little bit blood. So blood is for HIV, hepatitis B, hepatitis C, and syphilis. This is a government guideline. Those 4 tests has to be done in any eye bank. The idea is not to transmit any infection as much as possible. So in COVID era, almost eye banking across the globe got impacted. We could not got so many eyes also we lost. So then we suture it. There are procedure now where there is no suture. I'll show the photograph. So this is a patient with a corneal scar, and this is a clear cornea after replacing. So these are with suture, this is without suture, because we have replaced only the back layer. So it is like a normal cornea. You don't need to come very frequently in this, but in this case, because the sutures there, the follow-up is quite more means it's like 4 or 5 times in a year. So this is a pictorial diagram, says how scarred cornea replaced by clear cornea. This is a child who was blind. He could not talk. Also, he can't talk. So he is both cornea replaced. You can see how happy the child is. So coming to eye donation, the common some myths are there that you can't do, we don't remove whole eye. Let me clarify. This is a cornea donation because you can't change the terminology in DRUSTI Eye Bank. Especially, we remove only cornea so that the whole eye does not get disfigured. It's most of the places nowadays it is like that, but still some places they remove whole eye. Like I mentioned, the research is going for artificial cornea, but it is not yet foolproof. So therefore, we need the donated human cornea. So it is donated only after death. Again, the patient says that I'll donate a cornea to my daughter or son. This is not possible as per law, and it has to be within 4 to 6 hours. Earlier is better because we are in a country which is hot, humid. It's not in a cold country. It may be 8. Then we try to collect within 12. Like I showed the picture of diabetic retinopathy, I showed the picture of glaucoma. Even if the person is blind due to glaucoma, he can donate because his cornea is correct. Then retinopathy, his retina is affected, but cornea is fine. Similarly, those who use glasses, they can give their cornea, nothing to do with glasses. Family consent is mandatory in India, even if the person is placed, because we see a lot of pledging, especially when we go to young crowd and a lot of pledging, and people say I placed. But as per the law, the family member has to give, next of kin has to give the consent, otherwise you can't remove. So somebody dies at your place or known to you, want to donate, then please call iBank immediately. So as I mentioned, quick action is vital. So don't lose time in waiting as soon as possible. So you should have the death certificate ready. Otherwise, it again takes time. By the time the iBank team reaches, especially this is an voluntary collection. Although we want voluntary collection to improve in Odisha, it is not so like other states like Andhra and Tamil Nadu. At Odisha, it is less. We get mostly from hospital. So in home, so if you are waiting, switch off the fan. If refrigerator, if AC is there, AC can be on or cooler can be on. Put wet cotton cloth over the closed eyelid and raise the head with a pillow. So this much care can be taken by family member when they're waiting for the iBank team to come. So it can be done in any places. It's a simple procedure. It takes around 20 to 30 minutes for both eyes. It can be done in mortuary. It can be done in hospital. So not necessarily somebody has to bring the body to hospital. It can be done. And this is completely no money transaction. And this, whatever people are saying that cornea transplantation is costly, but the processing fee charge, not the cornea. Cornea is never sold or bought. And it is confidential, completely confidential, because many times the donor family asks, we have a patient who needs cornea, but there are cornea waiting lists. They have to go to ophthalmologist. So this cannot be like I give cornea and somebody from my family will get. Anybody can get. Again, we do not reveal as per law to who is the recipient. So this, as I told, does not disfigure the face if it is after removal. This is how it is completely aseptic procedure, sterile procedure. Like you can see, like the OT procedure, the technician who is removing has already completely now, because of COVID, all are disposable. It's an old photo where cotton was used. And this is how it looks. This is the portion, the transparent portion, and a little bit of the cornea. We take blood for this much serology test, so that the recipient is not will not transmit the infection. So this is the myth. The face or body will be disfigured, will be born blind in the next birth, will not be able to see God. So always give the example that when somebody at accident or the amputation is done, will the child with the next birth born without a leg? It's not like that. So coming to briefly about DRUSTI-DAAN eye bank, was started in 2002 by a few ladies. Mrs. Sundarajan is here, Mrs. Nalini Sharma, Mrs. Enu Narula, Dr. Padi, and few others. They started this. So the dream that time was to promote eye donation and to combat corneal blindness in Odisha. So that time it was not beyond Odisha, but currently we get a lot of cornea, so that after our use in our state, we are able to provide, but still I'm sure the people are waiting. Waiting means not, when they don't come to us, we don't know who is waiting, who is not waiting. Once they come to us, it's a zero waiting list for us. Somebody comes today, tomorrow he gets a cornea. So this is a corneal collection. You can see 2004 we got first cornea and 2006 is 30. But you can see 2008, it is 1500. I've not put 20 because 20 it got impacted due to COVID. 21 it is around more than 1200. And this is unfortunately what we want it to be better. That voluntary collection is very less. It should go up to 50% at least. That indirectly indicates that awareness is less. Although we have done tried to do lot of awareness, but it has not reached to mass public. So I'll request all of you who are listening, please spread the message. Of course, we have our limitation. We are not present at this point of time throughout Odisha. We are in Bhubaneswar, Cuttack, Balangir, Baleswar, Baripada, Raurkela, Puri. We are in many places. In future, we have planned to Bargarh. We are in Bargarh. So we need help from any other NGOs. So these are the places where we are located. We started with Bhubaneswar, Cuttack, but we are in these places. So we try to cover as much as possible, 50 or maximum 100 kilometers beyond that. Otherwise, it takes a lot of time to travel. By that time, the quality of cornea goes down. So these are the place form. In fact, we have a family place form. Once they place the form, then they get a certificate which says, I have donated, I have placed my eyes, so that the family member close, since they know the person wanted to donate. So that will emotionally people, otherwise this place has no role in donation. It does not reflect in donation. So I'll appeal that pledge your eyes, make it a family tradition. Motivate and educate others about eye donation. Motivate the queen of the seas to donate the eyes, as that is the only way to make them continue to live. So one donation gives sight to two. These are the numbers for contact. My numbers are like most of the time, because I am a clinician, I see patients. It's difficult for me to pick up the phone. Niladri can pick up. It's okay to take my number, but most of the time, because I see patients or I operate, it is difficult for me. But these are the number. Maybe I'll share with Dr. PATTANAIK, so that people in nearby, or you have any person who wants to donate, can contact us, and our team is always ready to go there and collect. Thank you. I'm ready to take any questions. We can't hear you, ma'am.
May I now request all our viewers, if you have got any doubt or any question regarding DRUSTI-DAAN, you can also ask by writing your question on the chat box, so that we can read out that, and ma'am will answer directly. So no need to unmute yourself and ask question. It's better to write down here, so that he will not be disturbed, and will try to maximize our questions. Yes, please.
Mrs. Sundarajan has raised her hand.
Yeah, Sudhaji. Yes.
Very useful webinar. So I am
Thank
very happy to see all concepts are very clear, no doubt. Thank you, ma'am.
thanks.
He is Dr. Harinder Singh, Principal, Shiv Shankar Degree College from Madhya Pradesh. Sundarajan ji, ma'am, do you want to say something?
Yeah, I just wanted to congratulate on this program. It's gone up very well. Like Dr. Sujata ma'am had told, we have to spread it to all the districts. And we
Yes,
need
ma'am.
the help of the local NGOs to
Sure,
promote this program.
sure, ma'am.
So,
Sure, ma'am.
Thanks.
so through programs like these, I'm sure awareness will pick
Yeah.
up.
We are having here, madam, friends from Sambalpur, from Jharsuguda, then from Puri, Jaspur, Cuttack, and one more from many people from Sambalpur also, Brajraj Nagar. So almost all are the leaders from that side. They are the scout leader, they are the unit leader, they are the teacher leader, like. So they can also have offline program so that doctor can move, Mr. Niladri can move, Jyoti ma'am can move, or a team can be moved to that place. And if they want, we can have more and more live webinar also, so that we can have a program over here. And here also I can announce, if you have any question regarding DRUSTI, and you take it as a challenge and go for individually, you can't know how much money satisfaction you will get by donating something and by donating eye. It's really amazing. And I have seen in two of the program where I saw how nicely the mother, even if he is in a distress condition, she is in a distress condition, so, she is living forever her child, but she wants to donate. So this is how we donate. So Jagannath ji, so we are having here Sambadik journalists like Lalananta Kumar, Sonu ji. So you can also motivate. You can also have a small request, small paragraph regarding Drishtidan, their mail ID and their program, so that it will reach each and every corner of Orissa, and no one should die without donating their eye. That is my aim, and we should, because our eyes are so valuable. If you love your eye, then donate it, and you will see you will be forever, even if you are living, but you will be forever in this loving world. So please, we are having also Jaivir Singh sir from Pune. Yes, sir. Do you have any question, please? Please unmute.
नमस्ते मैम।
Yes.
मैम मेरा एक सवाल ये है कि जो छोटे बच्चे हैं, आज उनके हाथ में कोरोना की वजह से मोबाइल तो मजबूरी में आ ही गया है, तो इनकी जो आईज है तो आंखें हैं, जो इनको प्रोटेक्ट करने के लिए क्या जीरो जो चश्मे रहते हैं वो जीरो का जो बोला जाता है वो बनवाने बेटर रहेंगे क्या?
नहीं, जीरो बनाने से कुछ ज्यादा फायदा नहीं है। उनको जितना हो सकता है मोबाइल नहीं देना है, जितना मिनिमम मोबाइल देना है, और आउटडोर एक्टिविटी के लिए बोलना है। अगर पावर नहीं है भी बंद करना है, बिकॉज हम लोग बहुत अभी कोविड के बाद बहुत देख रहे हैं जिसका चश्मा लग गया, नहीं तो चश्मा बढ़ गया। ऐसे जीरो चश्मा अगर पावर नहीं है तो पहनने का कोई जरूरत नहीं है। अगर एलर्जी वगैरह है तो कभी कभी डस्ट के लिए पहनने का जरूरत है, अदरवाइज पावर नहीं है तो पहनने का जरूरत है।
आंखों पे रोशनी आती है, टीवी तो ये रहता है कि चलो लाइट जला लेते हैं, लेकिन मोबाइल में तो ऐसा रहता है कि सीधा आंखों पे इफेक्ट होता है लाइट का। तो ऐसा कोई मतलब सॉल्यूशन है कि बच्चों को पहना जैसे?
नहीं, उनको बंद कराना है, उनको बंद कराना है। और बाकी जो चश्मा वगैरह बोलते हैं ब्लू प्रोटेक्टिव एंड ऑल, उसमें इतना सिग्निफिकेंट इफेक्ट ज्यादा कुछ नहीं है।
ओके मैम, धन्यवाद।
हाँ, बंद करना है, मैंने यूज जितना बंद तो नहीं करेंगे, थोड़ा कम करना है।
नमस्ते मैम।
नमस्ते।
आजकल एक मुश्किल हो रहा है कि बच्चे लोग को बहुत गेम आ गया है, बच्चे लोग को,
हाँ,
जो वजह से वो लोग कभी भी मोबाइल नहीं छोड़ेंगे, क्योंकि पिताजी माताएं सोचते हैं बच्चे ही मोबाइल गेम गेम खोलेंगे तो अच्छा रहेगा। रोने का जो मम्मी स्कूल जाता है, जहाँ भी जाता है, वो उसको मोबाइल पकड़ देते हैं, किचन बता रहे वही मोबाइल पकड़ देते हैं, जिसके कारण से आँख तो जल्दी खराब होगा।
तो
क्योंकि
हमारा
आँख,
ही गलती है।
इसलिए प्रोटेक्शन के लिए देखिए चाहिए, प्रोटेक्शन, क्योंकि उन लोग को ऐसा प्रोटेक्शन चाहिए जिससे कुछ बाद में कुछ नहीं होगा, क्योंकि मोबाइल पकड़ना ही होगा बच्चे लोगों को, क्योंकि गवर्नमेंट ने बोल दिया मोबाइल पकड़ो, और आदमी जो है घर में सब आदमी का मोबाइल पकड़ो। इसलिए इसका जो आजकल का जो आपका साइड में जितना टावर है उसका कैंसर भी तो बहुत सारा भी हो रहा है, लेकिन घर का आदमी नहीं समझेंगे।
The solution is with you, Mr. Ananta Kumar Singh. He is journalist from Puri, and he is also having web paper. So the solution is with you, we know, and we'll try to minimize their utilization of this telephone. And moreover, our aim is not only to take care of their eyes, but during this stage, but also how to keep up them ready for the next future. And they should have in mind that I have to take care of my eyes, and because I have to share it to someone to whom I love. Maybe in my lifetime, I may not be able to see him, but afterwards, if I'll donate my life, that means I'm still in that world. So by that way, we have to make a change with the children. And we can have more and more live webinar with them. If ma'am will get time, we can have one more also. Then we'll specially, just like Mr. Dhirendra sir, are you there? Sambalpur? Narendra sir? If Narendra sir is there, he's a man from Sambalpur. He used to show this program to 20 children by sitting at a place. So I found that sort of things in next program, so that we'll say the children will react or interact with ma'am, so that they will have their own question. And I know ma'am will impress them with her talk, and they will also get some technical knowledge how to take care of their eyes. The Harendra sir, yeah, sharing. Okay. So in this respect, if any question, please you can ask. I think Ratnaprabha ma'am, are you there? Dr. Ratnaprabha Devi? Madam Achanti? So anybody else wants to ask question, you can also ask. Thank you, Dajab sir. Suresh ji from Hindol College, do you want to ask any question? Yes.
Really, the program is very informative. Thanks to mom. And if we can arrange a awareness program among our volunteers, that can be give more impact upon the localities. So far as the information is concerned, it is easy to understand, better to aware through this program also.
Yes, sir. And combinedly with DRUSTI, the institution which worked hard for particularly for this purpose, we can have some more interaction with them also. And at that time, we'll have direct online placing. That is my idea. Do you agree, Madam Sundarajan? We'll have a interaction, and online Google form will make it available for them, so that they can fulfill that form and they can send it to us, and I'll send it to you, and we'll have an interaction. That will be better, ma'am.
Mrs. Sundarajan, yeah, we can do, but as I mentioned, people do that, but this is not going directly. This is basically to spread awareness.
Yeah, yeah.
But finally, as per the law, we can't take that.
Okay.
This
We
done still. It is done everywhere. We also do,
okay.
especially during eye donation fortnight. And
Yeah.
any organization asks for this, we give the form, they fill up and give it to us. But if the law says, okay, anybody has place they can collect without any consent, then it is working. Otherwise,
Okay.
it's not going to work.
Okay. So we
Madam.
can just
Yes,
yes, Vijaya ma'am. She is
Ji,
from
ma'am.
Assam. Yeah.
Yes, ma'am.
Uh,
Madam, I have a question. Actually, not question. I want to know. Some people says that by washing milk, my eye is very good. Is it true or?
Please
I
don't
want.
do all those things. It'll be nothing.
Yes,
A lot of people use mother's milk, then all traditional medication, they come with infection.
oh.
yes, ma'am.
If you don't have any question, we can go for the closing ceremony and we can say thanks to ma'am. Can I go for that? Okay. Now it's time to share a small memento to our ma'am, Dr. Sujata Das, for sharing her valuable time and very, very important topic.
Yes, ma'am.
Yeah. So I want to present a small memento on behalf of Mahasi College of Natural Law to ma'am. Ma'am, this
Thank
is 99th national webinar and Mahasi Degree College takes enormous pleasure to exalt this scrupulous personality who has been an epitome of humanitarian perseverance. Being an iconic educationist, medical practitioner, and social activist of our state, you have been a persistent source of pride and glory to our motherland. Ma'am, you have set an exemplary, outstanding personality among the intellectuals all over the country by your virtues. The Maharishi Degree College team and my webinar team regards you as a role model. Thank you, madam. Thank you so much, Dr. Sujata, ma'am. And now it's time to present a certificate to the participant. And I have shared the certificate. Shuman, are you there, Suman? Shuman, are you there? Okay, by that time I'll share the certificate. The first participant who joined over here, I'll request Dr. Here present our friend, philosopher, one of the most important colleague, Dr. PRAMODINI SAHOO ma'am. She is the head of the department Hindi, EMARTI Devi Men's College, CUTTAK. Now I request Dr. PRAMODINI ma'am to propose a vote of thanks. Ma'am.
थैंक यू मैम. थैंक यू मैम. दर्शकों को शुभ संध्या. 99 वेबिनार की हमारी जो कि श्रेष्ठ जो कि व्यक्तित्व के अधिकारिणी मुख्य वक्ता दृष्टिदान आई व्यान की मेडिकल ऑफिसर सम्माननीय डॉक्टर सुजाता दास महाशया जी, महर्षि कॉलेज ऑफ नेचुरल लॉ की प्राचार्य और वेबिनार की सभापति डॉक्टर नलिनी प्रभा महापात्र जी, वेबिनार की संयोजिका डॉक्टर नमिता पट्टनायक जी, रोवर और रेंजर यूनिट के सभी सदस्य और विभिन्न क्षेत्र से जुड़े प्रिय प्रतिभागियों, आज हमारे जो कि हमारे साथ हैं एक विशेष व्यक्तित्व के अधिकारी, देश विदेशों में अपनी कार्य दक्षता से प्रतिष्ठित वेबिनार के मुख्य वक्ता दृष्टिदान आई व्यांग की मेडिकल ऑफिसर डॉक्टर सुजाता दास जी, जिनको पाकर हम धन्य हैं और कृतज्ञ भी हैं। व्यस्तता भरी जिंदगी में हम अक्सर अपने शरीर की स्वस्थता के बारे में नजरअंदाज करते हैं, जो हमारे लिए लाभदायक हानिकारक है। खास करके डॉक्टर सुजाता जी ने आंखों को सुरक्षित रखने के अनेक सुझाव दिए हैं। उन्होंने आने वाली हेल्थ चेकअप, आई चेकअप के ऊपर दिया, जो हमारे लिए लाभदायक है। इसके द्वारा खास करके हम नेत्रजय रोग के कारण और प्रतिकार का प्रबंध कर सकते हैं। उन्होंने कहा कि बच्चों से लेकर बड़ों तक को वर्कशॉप के माध्यम से नेत्र सुरक्षा का ज्ञान प्रदान करना चाहिए। उन्होंने नेत्र जनित अनेक बीमारियों के बारे में हमें अवगत कराया। बीमारियों से बचने के जो कि जितने उपाय भी हैं उन्होंने बताया, ताकि हम आंखों को सुरक्षित रख सकते हैं। ये हमारे लिए बहुत गुरुत्वपूर्ण बात है। और मैडम, आपके इस बहुमूल्य वक्तव्य के लिए मैं महर्षि कॉलेज ऑफ नेचुरल लॉ के रोवर रेंजर यूनिट की तरफ से तहे दिल से आपको आभार व्यक्त कर रही हूँ। बहुत बहुत धन्यवाद मैम। हमारे जो कि महर्षि कॉलेज ऑफ नेचुरल लॉ के प्राचार्य और इस वेबिनार की सभापति नलिनी प्रभा महापात्र जी को भी धन्यवाद देना चाहूंगी, क्योंकि इस वेबिनार के लिए उनका भी प्रोत्साहन मिलता रहता है। संयोजिका जो कि सबका श्रेय सब श्रेय उन्हीं को ही जाता है, डॉक्टर नमिता पटनायक जी को। मैडम ने जो कि हम लोगों के लिए बहुत ही सुंदर टॉपिक जो कि पर वेबिनार का आयोजन किया है। उन्होंने आंखों पर कुप्रभाव कैसे टीवी और मोबाइल के माध्यम से कुप्रभाव पड़ता है और विभिन्न माध्यम से, तो फिर आंखों को कैसे सुरक्षित रखने पर उन्होंने भी जोर दिया। और आंखें जो कि हमारे, क्योंकि आंखें हमारे शरीर का अहम हिस्सा है, उनकी अभिव्यक्ति की शैली बहुत उत्कृष्ट कोटि की है और प्रभाव उत्पादक भी। मैडम अब अपनी मंजिल के करीब हैं, जिसके साथ स्वयं जगत के नाथ भगवान जगन्नाथ जी हैं। तो हर वेबिनार में उनको जरूर सफलता मिलेगी और मिलती रहती भी है। तो ये शुभकामना उन्हें देती हूँ, फिर आगे वो बढ़े। अंत में वेबिनार की सफलता में जो कि सफलता के हिस्सेदार जो हैं, विभिन्न प्रदेश से जुड़े प्रतिभागियों का बहुत बड़ा योगदान रहा है इस वेबिनार के पीछे। तो उनके बिना वेबिनार का आयोजन ही व्यर्थ है। इसलिए मैं महर्षि कॉलेज की तरफ से उन्हें बहुत बहुत धन्यवाद देती हूँ। खास करके प्रतिभागियों के जो कि चैट बॉक्स में दिए जो कि बहुमूल्य मंतव्य के लिए, और भी जो कि अपना विचार जो कि वेबिनार के माध्यम से बांटने के लिए उन्हें पुनः सादर धन्यवाद देती हूँ। मैं कुछ इस वेबिनार के संबंध में थोड़ा सा ध्यान आकर्षण करना चाहूंगी। और नेत्र के बारे में जो कि मैडम ने रखा, एक महत्वपूर्ण टॉपिक जो रखा, नेत्र जो कि है मानव जीवन का एक महत्वपूर्ण अंग है, अनमोल रत्न सदृश है। आंख वो इंद्रिय है जिसके द्वारा मानव इस सुंदर सृष्टि को दर्शन करने में सक्षम होता है। आंख चारों ओर के चीजों के प्रत्यक्ष ज्ञान का साधन ही नहीं है, वरन मनुष्य के मानसिक और शारीरिक स्वास्थ्य को भी प्रभावित करती है। जैसे आत्मा के बिना हमारा शरीर मूल्यहीन है, उसी तरह उत्तम दृष्टि शक्ति के बिना मनुष्य आंख होते हुए भी अंधा कहलाता है। सिर्फ इतना ही नहीं, नेत्र शरीर की सबसे महत्वपूर्ण ज्ञानेंद्रिय है, जिससे रूप रंग का दर्शन होता है। और अच्छी दृष्टि शक्ति उत्तम जीवन का आधार है। इसलिए दृष्टि का मनुष्य जीवन में बहुत बड़ा महत्व है। वास्तव में ये वेबिनार का टॉपिक बहुत ही महत्वपूर्ण है। हम मैडम ने भी वो जो कि नेत्रदान के संबंध में उसके महत्व के बारे में जो प्रकाश डाला है, मैं उसके बारे में भी दो शब्द कहना चाहूंगी। हम जितने भी दान करते हैं उसमें नेत्रदान सबसे बड़ा दान है, महादान है। मृत्यु के पश्चात हम जब नेत्रदान करते हैं, कोई हमारी आंखों से इस रंगीन दुनिया को देखकर खुश होता है, उसकी होठों पर मुस्कान हम ला सकते हैं। नेत्रदान कर अगर हम किसी अन्य व्यक्ति को रोशनी प्रदान करें तो इससे बड़ा बलिदान, इससे बढ़कर पुण्य का काम कोई भी नहीं हो सकता। आज हम देख रहे हैं नेत्रदान करने के लिए हमारे देश के लोगों में जागरूकता का होना बहुत जरूरी है। अपने वक्तव्य के माध्यम से हमारी मुख्य वक्ता महाशया जी ने कहा, बहुत कुछ सुना, बहुत कुछ कहा उन्होंने, हम जरूर याद रखेंगे मैम। और मैं वो शब्द जो कि कुछ कहूंगी कि जीवन का अमूल्य वरदान, नेत्रहीन को करे नेत्रदान। नेत्रदान नेत्रहीन के लिए वरदान। नेत्रदान का संकल्प ले ताकि किसी का अंधेरा जीवन उजाले से भर जाए। नेत्रदान महादान जो आपको बनाता है महान। नेत्रदान कीजिए, मानवता के हित में काम कीजिए। आज ही मानव जीवन का मूल मंत्र होना चाहिए। धन्यवाद मैम। सभी को पुनः मैं धन्यवाद देते हुए अपनी वाणी को विराम देती हूँ।
Thank you, Pramodini ma'am, for your nice presentation. And I want to present this certificate, which is signed by Dr. Sujata Das ma'am, the chief speaker, and our president, Dr. N.P. Mohapatra. This certificate, first certificate goes to Lala Ananta Kumar Singh, the journalist, for the web page Trutiya Nayan Puri. I may request Lala Ananta Kumar ji, please receive this certificate from ma'am, Dr. Sujata ma'am. She will hand over it to you virtually and it will be reached to you through your mail ID.
Many thank you, ma'am.
Sujata ma'am, on behalf of you, I'll send it to him. He's a very good journalist and he helped us in many programs with your kind presence and with your volunteership also. Thank you so much.
मेरे तरफ आप सबको बहुत खुश लगा आज और मैडम को बहुत धन्यवाद आप लोग को।
Thank you so much. So eye, the delicate organ in the human body, as you know, so we should take much care, much special attention to it, and particularly for the children. हम लोग को ऐसे देखना है हमारा जो बच्चे लोग कितना कम यूज करे मोबाइल, जैसे मैडम ने बोले हैं, और दृष्टिदान को सुबह शाम हम याद रखेंगे और कैसे छोटा मीटिंग करते हुए we'll request Niladri, we request Jyoti ma'am, we request Sundarajan ma'am, Nalini ma'am, so many ma'am are there in Drustidan. We can individually ask them to come over to our institution and we can have the place. And we can also put our signature, which is much more important. And on that day, she will share you how to donate and how you have to, after death, we will be not there. But how it could be done in right time and in right place. This is my idea to organize such a webinar. So once again, thanks to all of you. And I'm really bow down my heads before my Lord Jagannath, who has given me an uninterrupted program to continue this program with you people. And this good evening was so bright with the presence of Dr. Sujata Das and all of you. Thank you once again. And I want to close up the program here, ma'am. Can you allow us to close it here, ma'am?
Thank you so much.
Namaskar. Thank you. The last the salute to our guest. Thank you, Sujata ma'am.